Thermal burns, we know they're far more than just, surface wounds. They're really complex, dynamic injuries.
Yeah, and the damage can actually keep developing, sometimes for days after the initial injury, which has a huge impact on patients and their families.
Absolutely. So we've taken a deep dive into a range of expert sources looking specifically at thermal burns.
Right, and our goal here is really to unpack what these sources tell us. We're looking at the big challenges in burn care, how these injuries affect the body.
And crucially, this idea of adjunctive hyperbaric oxygen therapy.
Exactly. That's using oxygen, pure oxygen, in a pressurized environment alongside the standard treatments.
hmm
We want to see what the evidence in these sources suggests about the benefits.
Okay, let's start with the burn itself. The sources really stress that it's not just done. The damage evolves over the first, 48 to 72 hours?
That's a critical point. You immediately face massive fluid loss, incredible swelling edema, plus damage to tiny blood vessels, which messes up circulation.
So it creates this really hostile environment for the surrounding tissue.
Precisely.
Yeah.
And this leads to that concept of the zone of stasis the sources talk about.
Ah, yes. Explain that zone of stasis a bit more.
Sure. So it's this area right around the worst of the burn. The tissue there is injured, it's stressed, but it's not necessarily dead yet. It's kind of teetering on the edge.
Hang in the balance.
You got it. It could potentially recover if conditions improve, or it could worsen and become full-thickness damage that won't heal on its own.
And the overall picture the sources paint is pretty grim, isn't it? High mortality, long hospital stays.
Very much so. Mortality risk goes up significantly with age, the size of the burn, and especially if there's smoke inhalation involved. Plus, you've got constant battles with infection, pain management, and the sheer cost is enormous.
A huge burden on everyone involved. So, given all that, what do the sources point to as something that might help shift the balance?
Well, this is where adjunctive hyperbaric oxygen therapy comes into the picture. Again, it's adjunctive used with standard care.
Right, not instead of things like wound cleaning, dressing, surgery.
Exactly. The patient is inside a special chamber, breathing 100% oxygen at a pressure that's higher than our normal atmosphere.
Okay, so how does that mechanism specifically help with the problems we just laid out, according to the sources?
The main idea is flooding the body with oxygen. Under pressure, you dissolve much more oxygen into the blood plasma itself, not just relying on red blood cells.
And that extra oxygen gets forced into tissues that are struggling for it.
Precisely. Especially into that critical zone of stasis. The hope is that this extra oxygen helps those struggling cells survive, maybe prevents the burn from getting deeper.
So potentially stopping, say, a class 2 burn from becoming a class 3, or even class 4 burn, which often needs grafting.
That's the potential, yeah, preventing that conversion. It also seems to tackle the swelling, the edema.
How so?
The high oxygen levels can cause blood vessels to constrict slightly in a helpful way, reducing leakage and therefore swelling. Sources mention studies and observations by surgeons noting patients needed significantly less IV fluid resuscitation.
Less fluid, less weight gain from swelling, which probably helps circulation too, right? Less pressure.
Exactly, it helps break
Right.
that cycle. And then there's infection control.
How might it help there?
Well, white blood cells need oxygen to effectively kill bacteria, so more oxygen in the tissue might boost their function. Some sources also suggest it can enhance how well certain antibiotics work.
Okay, boosting the body's defenses. What about healing speed? That's often mentioned.
Yes, the sources do point to evidence suggesting it can accelerate wound healing. Faster closure, maybe less need for skin grafts?
Which would mean fewer surgeries overall.
Potentially, yes. One study mentioned patients needing significantly fewer surgical procedures. And it might also help the donor sites where they take skin for grafts heal quicker too.
That's a big factor for recovery. And pain. Burns are incredibly painful.
Right. There's evidence presented in the sources suggesting it could help modulate pain, possibly even that difficult neuropathic or nerve-related pain that can follow severe burns.
And I think you mentioned stem cells earlier.
Yeah, there's some research noted in the sources exploring whether hyperbaric oxygen helps mobilize the body's own stem cells to the injury site to aid in repair.
So looking at all this from the sources, decades of animal studies, human studies, clinical reports, there seems to be a lot pointing towards benefits like reduced mortality, shorter hospital stays, fewer operations, lower costs.
It's a substantial body of evidence, certainly.
Yeah.
You see consistent themes across different types of studies and clinical observations.
But there's always a but, isn't there? Widespread adoption isn't quite there yet.
That's the tension. While you have meta-analyses and expert consensus often supporting its use for specific indications, getting those huge, gold standard, randomized controlled trials done for burns is incredibly tough.
Why is that?
Just the variability. Every burn is different size, depth, location, patient health, associated injuries like inhalation injury. Creating perfectly matched groups for a large trial is a massive logistical and ethical challenge.
Makes sense. Hard to compare apples to apples when every apple is unique.
Pretty much. So let's bring this back to you, the listener. If we accept the potential benefits outlined in these sources,
Better tissue survival, less swelling, faster healing, less infection, maybe less pain.
it translates to potentially better survival odds, a quicker recovery, maybe less scarring down the line, fewer trips to the operating room, and getting out of the hospital sooner. Real, tangible impacts on quality of life.
And for caregivers, for the healthcare system.
The sources suggest a potential easing of the care burden and significant cost savings. Shorter stays, fewer complications, fewer procedures that all adds up financially.
So, wrapping this up, the sources we explored present a really compelling argument that adding hyperbaric oxygen therapy to standard burn care targets some of the core problems.
Yeah, it seems to directly address issues like tissue oxygenation, the damaging swelling, infection risk, and healing delays. The evidence suggests it can lead to better outcomes.
Which leaves us with a really interesting, almost provocative thought to end on.
Right. If there's this much supportive evidence from various types of studies and clinical experience suggesting improved outcomes, better quality of life, and potential cost savings, why isn't this therapy a standard, universal, integrated part of burn care protocols everywhere?
It definitely makes you think about how medical innovations get adopted, especially when those big, definitive trials are hard to conduct, but the need and the potential benefit seem so high, something to ponder.